So my name is Charlie Starkman. I know it says that it's Charles on there, but we'll make it a bit more casual. I'm a staff psychologist at UM-Dearborn CAPS, as well as the outreach coordinator. So I received my doctorate in clinical psychology, and I've been working at CAPS now for the past 6 months. In the role of outreach coordinator, I work to build relationships with different departments on campus, faculty, staff, students, and coordinating outreach events that really cater to the needs of the campus community. And in terms of what I do at CAPS outside of my outreach coordinator job, I provide individual, group, and couples therapy to students. I also supervise our trainees at CAPS. We have trainees from different grad programs in the area. These are things that I'm passionate about, as well as the topic that we're going to be looking at today, which is acceptance and commitment therapy, or ACT. It's not pronounced ACT like that test we all had to take to get into college. It's pronounced ACT. So let's get started. I included a quote here from John Kabat-Zinn. He's actually a molecular biologist, but he is the founder of an approach to therapy called mindfulness-based stress reduction, MBSR. So one of his, out of many very good quotes that I enjoy, is, "You can't stop the waves, but you can learn to surf." And this will be sort of a theme that we'll come back to throughout the presentation. So the reason I chose to present on ACT today and lead this workshop is because this is the approach to therapy that my own practice is centered around. And so ACT has several goals that I think make it a lot different from other types of therapy. And really the main, most important goal of ACT is to help clients and just people in general to create a rich and meaningful life. And with that, we also work to build acceptance that pain is an inevitable part of life. But to be able to accept pain is part of what helps us to reduce suffering. And suffering is the avoidance of pain. Now, we also will experience suffering at some point in our lives, but we can mitigate that suffering. We can make it less by accepting the fact that pain is inevitable. And I'm sure that all of you have experienced pain in some way in your life, whether that's a loss of a loved one, the ending of a friendship or a relationship, could even be physical pain, like chronic pain. And it appears in a lot of different ways, but a lot of times folks seek out therapy because they are having difficulty coping with pain. And this is something that an ACT therapist would address with their clients, how to work towards accepting that pain is inevitable. Other goals of ACT include being able to transform your relationship with difficult thoughts and feelings. And through changing that relationship, we can actually work to contact our thoughts, even the ones that feel really uncomfortable, the ones that we don't like, the ones that kind of give us that icky feeling that we just we want to push away. We don't want to think about them. Another goal of ACT is to work towards taking effective action, and that's guided by our values. And we'll talk a lot about values today and how those really kind of shape our behaviors and the things that we are working towards in our lives. And the last goal that I've included is to be present and engaged in your life. This is something that is so important because let's say that a person is depressed or anxious. They might be thinking, about things that might have happened in the past, or with anxiety, very future focused, and you really struggle to, be present in the moment and really stay engaged. And of course, it's very difficult to do that if your thoughts are concentrated on the past, or you're very anxious or nervous about something that may or may not happen in the future. So all of these together create the goals of ACT. So why practice ACT? Why bring these skills into your life? So ACT is a mindfulness-based, values-directed behavioral therapy. So breaking that down, we're looking at ACT as a way to build awareness and presence in the moment. And as I stated before, ACT is really based on this idea of values and direction. So moving in the direction of your values in order to help shape your behavior, especially to shape your behavior to be more effective. And each letter of ACT is part of the acronym. It means something. So we'll go through each. A is to accept. So accepting your thoughts and feelings and being present, one of those main components of being mindful. C, choose, choosing a valued direction, moving in a direction. And I'll talk more about that in terms of thinking of values as a compass, but thinking about how we move in a direction that means something to us. It's all about meaning. And T, taking action, taking steps towards moving in that value direction and also meeting the goals that you set. And when we practice ACT, again, it's a practice. It's something that we have to do over time. It's not like, it's sort of like riding a bike, right? You can't just get on the bike and magically be able to ride it without any sort of training wheels, right? Or any sort of practice at all. You have to be able to work and practice these skills in order to have them become consistent, almost more like second nature. So what this means is that you get to accomplish and do more of what is really important to you. Some more reasons why we might want to practice ACT. ACT is such a great therapy because it teaches us different skills, different psychological skills to help us handle those painful thoughts and feelings I was talking about earlier, the ones that feel icky, that we really don't like, and we want to do anything that we can to avoid them. But these skills will help us to handle these thoughts and feelings that are causing us so much pain more effectively. And as a result, we're going to spend less time in that state of suffering and more time engaging in our lives, living a meaningful life, something that really matters to us. And ACT also allows us to take inventory of our lives and of our values. You know, we want our clients, when they leave therapy, to be able to recognize, you know, what is truly important. What are my values? What are the things that matter to me? So we're going to go through and do an experiential activity together. So for folks who are willing to participate, all you'll need is a pen and paper, like so. You can also create a note on your smartphone or a tablet. And we are going to start by choosing 1 to 3 emotions to reflect upon. So I've listed some examples here, a mix of primary emotions, ones that are hardwired into us that we all experience, as well as some secondary emotions like anger and grief. And so some examples: jealousy, guilt, fear, frustration, sadness, and feeling overwhelmed, which definitely as a student, I am sure that everyone tuning into this has felt at some point. So once you've chosen your 1 to 3 emotions, you're going to ask yourself this series of questions. So how does this emotion currently impact my thoughts? How does this emotion currently impact my actions or behavior? Because thoughts, actions, and feelings and emotions are all interrelated. Asking yourself, what would life be like if I were able to handle this emotion more effectively? And also, how would my relationship with myself as well as my relationship with others be different? So once you've identified your emotion, or 3, and you've asked yourself these questions, you're going to be able to get a greater understanding of how these things interrelate, and really, you know, being able to increase your sense of mindfulness of how your emotions are able to drive your behavior, and also to see that there's always room for improvement. This is something that is so important because we're always trying to think about our strengths and, you know, we always, as human beings, are working towards improvement. We are always striving towards something. So this list is going to be really helpful to use later on in the presentation. So it might be difficult to get started. This is probably a very new experience for most of you. And I've included some examples here. So we'll go through them really briefly. Maybe think about having a hard time making new friends due to some anxiety about what people might think of you. Social anxiety is really common. And as a result, this anxiety might prevent you from meeting new people, might prevent you from engaging in class, or just meeting new peers, meeting new people. Thinking about anger, we often say that we let our anger get the best of us. And as a result, we often say something that might have hurt someone else. And that leads to those feelings of guilt. And it ultimately might damage some of the relationships that we do have and that are important to us. Jealousy is also another really common emotion. And thinking about how jealousy might have impacted your relationship with a significant other, with maybe even a sibling, or with yourself. And this could impact your confidence, the way that you feel about yourself. And as a result, it might create distance between you and friends, loved ones, the people that matter most. And we want to be able to start to reduce that distance, enhance that closeness. And I included these examples just to kind of give you that sense of how our emotions can affect not only our thoughts, but also our actions. So, mindfulness, using it as a tool. And I'm sure a lot of you might have heard of different mindfulness-based apps. Maybe you've used some guided mindful meditations of your own. And mindfulness has some consistent themes within it. Being able to pay attention, bring your awareness to the present moment without judgment. According to ACT, we're also thinking about mindfulness as, yes, paying attention to the present, but we're including some other terms here: flexibility, openness, and curiosity. So we've got 3. Now, what does that really mean? So let's start with flexibility. In this process, we have to be able to be flexible because the present moment is changing all the time. And we have to be able to learn to flow with the tide and not against the tide, right? So John Kabat-Zinn's quote earlier on about, the surf, right? We have to be able to ride with the surf and lean into it and not try and go against it, right? Now we also can think about openness and how openness really allows us to fully allow and experience these difficult, painful, or unpleasant emotions to be present. And avoidance, which we all engage in, and we'll talk about that a bit later, because avoidance is definitely a huge part of what can contribute to anxiety, especially. And ACT is very much focused on avoidance because that's a huge part of what can make some of our difficulties worse. And you might have noticed, even in your own experience, that while avoidance might feel really good in the short term, it's like, whew, yes, I don't have to deal with that anymore. It can actually increase painful thoughts and emotions because we're pushing it away. That doesn't mean that we're actually confronting it or dealing with it. And curiosity. This kind of brings in this very interesting, playful element to our thoughts. So you might be thinking, wonder why this situation is making me angry, as opposed to immediately jumping to that place of that person is a jerk, I can't stand them. We're then creating judgment, right? And as a result, that's taking us away from being mindful, because mindfulness is all about non-judgmentalness. So now that we have a better idea of how to use mindfulness as a tool, thinking about flexibility, openness, and curiosity, I'm going to get into a little bit of the ACT Hexaflex. So this is going to be completely new for everyone and anyone that is watching, but I'm going to try and break it down in the best way that I know how, so that everyone can really understand and feel connected to these different aspects of the hexaflex, because they are really important. And like a hexagon, there are 6 core areas of interest here. Right? And all of these areas lead to this common goal, as you can see in the center of the hexaflex, of psychological flexibility. And each of them work together as a system. As you can see, all the lines are, moving from each aspect of the hexaflex. So they're all, again, interrelated, right? So I'm going to break each one down for you, and hopefully this will help to kind of understand each component of the hexaflex. So let's start with present moment awareness. We are trying to be able to contact the present moment. So what this means is we are consciously aware. So being attuned, being present, right, of your different experiences in the present moment. And what this means is that we can fully engage with what we're doing, which is ultimately the goal. It also allows us to take account and take inventory, right, of really useful information. So we might ask ourselves, should I continue to engage in this action, or should I work towards changing this action, especially if it's really not helping us to stay consciously aware, to be aware of the present moment. Now we're going to look at acceptance. So we're going to be doing it counterclockwise. Acceptance. That means that we can work towards putting our defenses down. We're giving ourselves permission to be compassionate to ourselves, right? Being able to accept that we can approach as opposed to avoid. We can move towards our difficult or painful thoughts, feelings, without having to run away from them, even if they are really challenging, and they're going to be challenging. We'll move on to diffusion. So this really focuses on thoughts and basically helping us to recognize that these thoughts are not us as a person. So we all have some very strongly held beliefs, especially about ourselves. We might think, I'm unlovable, or I'm never going to amount to anything. And, just as some examples, you might be able to pick out, a thought or belief that you have about yourself that almost feels like it's playing on a loop, and that you experience it so frequently that it's kind of become like the gospel truth, right? And as a result, it really becomes you. That thought becomes who you see yourself as. And the goal with diffusion is not necessarily to get rid of these thoughts. So it's not just to push them away or make them go away, but it really is a way of changing the way that we relate to these thoughts, and being able to do that in a way that makes them less personal to us. So not treating them so much as the gospel truth, as something that we have to take as, what we are. This thought is not us. And what that does is allows us greater psychological flexibility. Self is context. Now, this is probably, out of all the aspects of the hexaflex, the most complicated for folks to grasp. I like to think of it as being able to practice being a fly on the wall, right? So observing yourself and thinking about your context. So looking really more at the situation, thinking about the thoughts, feelings, and actions that you're experiencing or engaging in a particular context or situation. So being able to kind of take that step outside of yourself and looking in, which allows us greater psychological flexibility. Values. So I've brought up values a little bit already, but we're definitely going to get into it even more. But a quick overview. So you might be thinking, okay, I've gotten a little bit on values so far, but a lot of times values, people get them confused with goals. And they're, again, kind of related to each other, but we might be able to think of values as points on a compass, right? Because if we're thinking due north, there's no end, right? If our value, let's say, is to be, to be a better friend, or, to be a better sibling, there's no real end point to that, right? It's something that we're always working towards. We're always moving in that direction. And a goal has an end point, right? So we might set a goal for ourselves to exercise for 30 minutes 3 times a week, right? And when we achieve that goal, then we can set a new goal for ourselves. But health as a value and wellness, those don't have endpoints, right? But they're also something that we desire. There's something that we're working towards. And last, we have committed action. So what that means is that we are making a choice to move in a values-guided direction. And this is being able to do this in an effective way, being mindful both of our actions as well as making sure that our behaviors are in line with those values. So hopefully that made sense. This is kind of a challenging concept, but I hope that I was able to break it down for you all in a way that that makes sense. So we are going to go through and do an experiential activity surrounding mindfulness. So as I said before, mindfulness is a skill that requires practice. And this activity that I'm going to guide everyone through will help in order to experiment with the F, the O, and the C: flexibility, openness, and curiosity. So what I'd like everyone to do is just to take a minute to simply allow yourself to be present with your current thoughts and emotions, and notice any physical sensations that might be temperature, aches and pains, tension, clothing, etc. So I'm going to give everyone a minute to build that presence. Okay. Now, imagine you're watching TV, and this TV isn't any ordinary TV. It's a TV that broadcasts your thoughts. You're alone and in a safe place where you're able to watch this TV with curiosity, not judgment. Might be observing some of these types of thoughts on the screen. I'm hungry. I wonder when I can see my friends again. Wonder if he texted me back yet. Maybe I should just check quickly. And take a couple minutes to observe with openness and curiosity to the thoughts displayed on the screen. When a new thought appears, the old thought disappears. And give everyone another minute or so to just observe these thoughts on the screen. And now I want you to think of your answers to these questions. Did you notice any strong emotional reactions during this activity? Did you notice any repetitive or painful thoughts? Were you able to be mindful with flexibility, openness, and curiosity? Or did you occasionally, maybe more than occasionally, find yourself judging yourself or the activity? This is just a glimpse into what a few minutes in our mind looks like. And think about how busy our mind is in the course of an entire day, maybe even just an hour. If this was a few minutes, think about just an hour. And mindfulness is hard, but being able to observe those thoughts on the screen helps us to detach, be that fly on the wall, right? So practicing self as context, and we can be the observer. So we are not our thoughts. We saw those thoughts on the screen, on that TV, but that doesn't mean that we are our thoughts. And when we allow our thoughts to go unnoticed, what can happen is that they might begin to wreak havoc, basically. If we attempt to run away from them or avoid them, that is avoidance. And it's something that we're going to definitely talk about right now. This concept of experiential avoidance is central to ACT. So what this means, let's break it down. Trying to avoid certain experiences, feelings, thoughts, emotions, even when doing so could be harmful, costly, and ineffective. And from an ACT standpoint, these attempts to avoid can actually make things worse, causing more psychological distress. And there are a lot of different effects that high levels of experiential avoidance might have in different areas of our lives. It might affect our productivity at work. It can lead to high levels of anxiety or depression. It also might lead us in the direction of higher risk behaviors such as substance use, gambling, compulsive shopping, and also lower reported quality of life. We're not functioning the way that we would really like to be. And ACT is such a great approach because it helps us to reduce that avoidance. And not long ago, a couple of minutes, when we closed our eyes and we really imagined our thoughts on that TV screen, some of them were probably emotionally charged. They might have been really frightening to look at. Sometimes our thoughts become very scary, and they feel so real that it brings up a lot of feelings of fear and anxiety. But when we're mindful of these distressing thoughts, we can use those diffusion techniques, right? So remembering what diffusion is, looking at our thoughts, knowing those thoughts aren't us, that we can change the way that we relate to our thoughts. And they can become less personal, not that gospel truth, right? Which allows us to be more psychologically flexible, ultimately the goal of ACT, right? And cognitive diffusion can help to release that unnecessary suffering that can cause us to not live the life that we want to live. So, fusion on one side, diffusion on the other. A person comes into therapy being very, very fused to a lot of unhelpful or ineffective thoughts, right? The goal, as you see with this green check, is to move towards a place of diffusion. So here are some examples of what a person's thoughts who is very cognitively fused might look like. They might see their thoughts as reality, 100% accurate, pure fact. Their thoughts are serious, and we should be giving them our full attention all the time. our thoughts might know best, and that's just how it is. This thought is what life is. And it could be that we're thinking my thoughts are orders and I have to obey them. I have to listen all the time. But let's look at the other column and think about how we might be able to take that step towards diffusion. We can ask our thoughts questions. Just because we have a thought, that doesn't necessarily mean that it's true, right? Thoughts don't necessarily need our attention all the time. We actually have up to 50 thoughts per minute. That's a lot of thoughts. Unfortunately, our brain tends to pick out the ones that might be the most distressing, but we can start to move in that direction of diffusion when we think about our thoughts requiring attention only if they're helpful. We don't have to listen to our thoughts. And when we really break down our thoughts, there's sounds, words, stories, and just bits of language that are pieced together and they're passing through our head, right? They're not necessarily this gospel truth. They're components of things. So let's go back to that TV screen. I've listed some examples of diffusion techniques, and some of these broadcasted thoughts on that screen might have caused you some distress, and that's normal and expected with that experiential activity. So you can play around with some of these techniques during that exercise when you try it again, and also just in your daily thought patterns. So some examples, you might be able to read your thoughts in a silly voice, singing the thoughts out loud, making them into song lyrics, thinking about or imagining peaceful scenes, funny scenes in the background of these thoughts or images. Thinking about thoughts as bubbles that you can pop. Right? That's always very rewarding. Labeling the thoughts. So in other words, thinking, planning, and there are so many, and you might be able to think of your own. And there are so many different ways to be able to diffuse these thoughts. Now we're going to get into values. So what do you really want in life? We ask ourselves these questions as we engage in this movement towards the values. So we start with, what do you really want in life? What is important to you? What do you want to do with this one life that you have? What sort of person do you want to be? What are some of the strengths or qualities that you want to develop? And what are the sort of relationships that you want to build? You can jot these down. You can phrase them as things to think about. It's really up to you. But really thinking about these questions can make a big difference. And the values bullseye. Excuse me. So this bullseye is a visual representation of where we are acting either consistently or inconsistently by our values. So when I have clients do this in my sessions, I'll have them put in X usually to show which areas are on target and the areas that might need some practice. So for example, we've got different values, relationships, personal growth and health, work and education. These are areas that matter to us, right? So we want to see where we are getting closer to that bullseye, right? That we are living fully by my values, that we are committed to engaging with our values, moving in a values-guided direction. The further away we get from the bullseye, that might mean that we're not in a place where we're acting consistently with our values, right? The relationships might not be where we want them to be. We might not be taking care of ourselves. Our schoolwork might not be a priority and our grades might be slipping a little bit. So we want to be able to identify how we can move closer to that bullseye and where we can practice a bit more. So we are going to tie all of this together. So remember way back in the earlier slides when I had everyone make that list of emotions? I want you to get that list back again. And you're going to look at whether your values align with the way in which you're handling these emotions. So let's look at this example. If being a good friend is a value to me, but you might find yourself isolating from friends if you're feeling sad, feeling insecure, anxious, that isolation is not a values-driven action. And oftentimes, even if things are going well in a lot of different areas of our lives and we are moving towards that bullseye, we might find that we're not living in accordance with our values in all domains, right? So if you find that, we want to break it down. So here's where we can dig a little deeper. We're going to pick that problem apart, right? Where am I avoiding? What thoughts am I allowing to push me around, bring me down, hold me back? You know, what are some of the things I'm staying away from? What have I withdrawn from? Maybe that means you're not as involved in a student org as you might have been before, or you were going maybe to a study group for one of your classes, and maybe halfway through the term you decided that you didn't want to go anymore. We also might find that we are, putting things off for later. Oh, I'll do that later, but later never comes. Right? And also thinking about what are some of the things that are keeping me stuck in the long term, right? So that might be ways that we are not using our time wisely. Things might be draining our energy, not taking care of our health, right? Or we might notice a worsening in our relationships. So again, really being able to dig deeper into these different areas of our lives where things might not be going the way that we want them to. Here's another acronym that I want everyone to think about, the FEAR acronym. These are the barriers to action, right? Values-based action isn't easy. No aspect of ACT is easy, because if taking these actions, doing all these things were natural and easy, I wouldn't have to be giving this presentation and y'all would already be doing it. So this is something that takes practice, and we have to be dedicated to it if we really want to move towards our values, if we want to live a rich and meaningful life. So let's look at the F, fusion. So these are those thoughts that get in our way. This is too hard, I'll fail. Without these diffusion techniques, we might get stuck in fusion. We are fused to these thoughts. Excessive goals. Now, it's good to have a couple of goals, right? But if we're thinking either so far ahead or we're loading so much onto ourselves here in, the short term, we have to really ask ourselves, are we being realistic? Maybe we need to sort of scale back and set, one or two goals that are extremely important to us and that we know that we can meet. We function really well when we are able to accomplish something, when we've mastered something. And so that might mean that we need to scale back our expectations and our goals so we can achieve that feeling of accomplishment. Avoidance of discomfort. Being asked to change something is really uncomfortable. Change and transition is hard. All of the transitions that we've been going through with COVID, they're uncomfortable. It's probably been really hard to learn from home, have remote classes if you've never had them before, and you've probably felt uncomfortable at some point. And R, remoteness from values. So really thinking about, is this a value that you truly feel connected to, right? Or does society make you feel that it should be important to you? And really keeping in mind those should statements, right? Because sometimes those can get us stuck. And what might happen is we might start to lose touch with why this work is important, right? And when we lose touch with why this work is important, it can lead to barriers in action, which is what we want to do. We want to take committed action. So we have to be able to get back in touch with those values so that we can do that. So we know fear, and now this is the opposite acronym. Here's how we can overcome those barriers to action. So we'll start with D, diffusion, right? Hopefully everyone now knows what diffusion is, being able to look at our thoughts, knowing that our thoughts aren't us. Right? Accepting discomfort, knowing that change is not always pleasant, but as we're able to work towards acceptance, put our defenses down, we can start to move towards as opposed to running away from challenging emotions. R, realistic goals. So like I was saying before, maybe setting 1 to 2 achievable, doable goals that will help you to feel accomplished and demonstrating mastery over something. And last but not least, E, embracing our values. So moving towards the things that matter to us, our desires, what we want to live for, what we are striving for. So as we are finishing, we're going to experiment with one last mindfulness activity. And this activity is called mindfulness of the hand. So what I'd like everyone to do is to notice your hand. And not just looking at it passively, but really noticing your hand, looking at it. And I'm going to ask you to look at it for, let's say the next, how are we doing on time here? Let's say the next like 2 to 3 minutes. And before we do that though, ask yourself what your mind has already predicted about the next 2 to 3 minutes. Perhaps your mind has predicted that this activity will be boring, difficult. Our mind sometimes is correct, sure, but sometimes it can be off. And remember, our thoughts aren't always the truth. So we'll see what happens while being flexible, open, and curious about the next few minutes. So place one hand palm upward near your face so that you're able to study it. Notice the outline of your hand. Notice the shapes of the spaces in between your fingers. Notice the color of your skin. Notice how the color changes from place to place on your hand. Now, notice your palm. Zoom into one of the lines on your palm and see, really notice how there are many, many smaller lines feeding into it and branching out of it. Now, bring your attention to the fingertips. Notice the spiral pattern and notice if you can trace that pattern down into your palm. And now notice what it feels like to move your hand, bending your fingers, maybe clenching your fist, and also just studying your hand again. Really looking at it, noticing all the different facets of it. And now our time is up. Notice if any of your mind's predictions were correct. And when we are mindful, when we are curious, when we're flexible with our thoughts, we are able to live our lives in a more meaningful way. It helps to contribute to a richer existence in our work, our schooling, our relationships, and our personal growth. I hope that everyone enjoyed this presentation. I hope that you were able to take something away about ACT, something that you are able to use in your day-to-day life, whether that's being able to practice more mindfulness-based activity, whether that is getting in closer contact with your values and identifying them, practicing being a fly on the wall and looking at yourself in context, and taking steps towards your values, taking steps towards the things that matter to you. I hope that all of you have a wonderful day and stay safe and be well. Thank you.